I haven't had many negative responses at all. If you tell your friends and family, usually they're just inquisitive or just want to know a little bit more, but they don't usually react badly to you telling them.
So what about in the workplace, especially in the hospital with other medical professionals? How did they respond?
I actually was very well supported by my hospital network that I was at the time. I remember my colleagues started sharing their own stories with mental illness that I wasn't privy to before. So it was almost like, AA, everyone was telling their stories and sharing. What I found really incredible is that we all had our own stories, and not that you need to come to work with a sign saying, I have this, but we all had been either personally or from a friend affected by mental illness. And I realised that it's actually not an uncommon problem. It's just that there's so few of us talking about it. So I think people do want to talk about this. They're just not necessarily sure how to, or maybe they don't have the language to do it.
Do you see people reacting differently when somebody discloses a physical diagnosis versus a mental health
Definitely. We haven't closed the gap between the two. I often reflect that if I had had a physical illness like diabetes or, God forbid, cancer, I think the hospital networks would have handled it very differently to mental illness. One is to do with stigma and ignorance, lack of understanding. But the other thing with mental illness is that it's not easily visible.
Right. Yeah.
So, if you break your arm and you have a fracture, you can actually see it in the plaster. You can x-ray it, you can see the bone remodeling, you can see the healing process. When something affects the mind, it's not easily visible, and for the person suffering, they may not be able to articulate what they're going through, so it's not as easy to stage their sort of journey and their progress. Given mental illness is so common, affecting 1 in 5 people in Australia each year, I think we sort of owe it to upskill ourselves and to educate so that if our employees are in trouble, we can look after them appropriately.
100%, yeah. Do you think that sharing the fact that you do have bipolar disorder has made you a better doctor?
That's an interesting question. Inherently having bipolar disorder has given me more empathy.
Okay.
I'm sort of in a unique position in that I've experienced both sides of the fence. So as a clinician, I look after people with mental illnesses. And in fact, I actually did some of my medical rounds in places where I was previously hospitalised as a patient.
Oh, wow.
So I've sort of come full circle.
Yeah.
I can definitely connect with patients. If they have mental illnesses, I don't sort of put them on the side. I treat them with the same respect as physical illnesses.
Did you experience any barriers when trying to access help?
So when I was a second year medical student, I actually had another hypomanic episode. I was amongst all my medical colleagues, maybe 200 medical students, medical lecturers, tutors, etc. And I think people knew something wasn't right, but despite that, no one was really able to get appropriate help for me. If a medical student amongst medical colleagues and lecturers couldn't get the help they needed, imagine what someone in widestream community faces.
What do you think as a society we can do to help reduce the stigma?
That's a big question. I think it starts with conversations like this. There's sort of 2 parts to the problem. Number 1 is raising the awareness, and part B is really what do we do with that information. But definitely I think the beginning of shattering stigma and taboo is always speaking up, letting people know that they're not alone. And then hopefully if someone watches a video like this, they may feel less afraid to reach out for help, or they may realise that, hey, mental illness doesn't discriminate. You can be, not that there's anything amazing about being a doctor, but you can be a doctor and have mental illness and still be high functioning. And that's something I always try and impart to people, that you can still be a high functioning individual with the label. It doesn't stop you from achieving your goals. It doesn't stop you from living a full and well-rounded life. It doesn't mean it's easy and there are obstacles and hurdles to overcome, but you still can accomplish everything that you want to, despite those struggles.
Thank you so much for sharing your personal experience. You've offered amazing insight. I'm sure everybody is going to gain a lot, and thank you so much.
It's my pleasure.